In the world of healthy eating, where every food is seen as a potential ally or enemy, the diet of people over 60 deserves special attention. It would seem that there is nothing more harmless than fresh vegetables, but some of them can have an adverse effect on the cardiovascular system. Many older adults, striving to maintain their health, actively include greens in their diet, limit sugar intake, and avoid fried foods. But as practice shows, this is not always enough. There are certain types of vegetables that, if used incorrectly or in interaction with medications, can subtly undermine heart health. Some of them contribute to increased blood pressure, others disrupt the action of vital medications, and still others may contain bacteria that a weakened body can no longer cope with. Next, we will talk about 5 specific vegetables, the consumption of which should be limited or the method of preparation changed for older people. For each of them, the potential danger will be explained in detail, and safe and heart-healthy alternatives will be offered. It is important to understand that these risks can be avoided if you know what to look for and what foods to avoid. The information presented below will help you make informed choices in favor of health and longevity. At the forefront of the list of potential threats to health, especially for older adults, is spinach, which can become an unexpected adversary when heart medications are not all powerful. This leafy vegetable, which is traditionally presented as a model of healthy food, is indeed a valuable product for many. However, for people aged 60 and older, especially those who take medications to maintain heart health, spinach can gradually turn into a serious danger. As a practicing cardiac surgeon, the author of these lines has repeatedly encountered situations where patients, confident in the impeccability of their diet, were actually undermining the action of vital drugs with their addiction to healthy food. Spinach is high in vitamin K, a substance that plays an important role in blood clotting. This is where the danger lies for those who take anticoagulants, such as warfarin, which is often prescribed to patients who have had a heart attack, stroke, or suffer from atrial fibrillation. Excessive consumption of vitamin K can neutralize the protective effect of the drug, leading to blood thickening and weakening of the therapeutic effect. The most alarming thing is that most older people are not even aware of this risk. They may feel well, believing that the medicine is effective, while their body is deprived of the last line of defense against a deadly blood clot. Doctors often have to deal with the consequences when patients, striving for a healthy lifestyle, include spinach smoothies or large portions of salads in their diet and end up in the hospital with mini strokes or thrombosis without even suspecting that this is the reason. Spinach itself is not the cause. The problem lies in the lack of stability in its consumption. If it is present in the diet, then it should be consumed in moderation and on a regular basis, and the doctor must be informed about this, especially when making changes to the diet. After all, food can both enhance and neutralize the effect of drugs. The reality is that not all vegetables are equally beneficial for the heart in old age, and some of them can do more harm than fast food if you do not exercise due diligence. If spinach can so subtly affect the effectiveness of drugs, then what other seemingly harmless vegetables can hide a threat to the heart? It is worth paying attention to one popular product that is probably already in the refrigerator of many and contains more salt than a bag of chips. We are talking about pickles, which are a real salty trap for the heart. Crispy with a spicy taste, often acting as an ideal addition to dishes, they seem harmless and even refreshing. However, for people over 60, especially those suffering from high blood pressure or heart problems, this innocent treat can cause significant harm. Few people realize the danger that ordinary pickles hold, but these modest green slices can contain a truly colossal amount of sodium, sometimes over 1,000 milligrams per serving. This is equivalent to 2/3 of the daily salt intake recommended for older adults, and all this is in a few harmless pieces of cucumber. Salt is more than just a flavoring agent. It's a chemical compound that retains fluid in the bloodstream, thereby increasing blood volume and creating excessive pressure on the heart and blood vessels. Over time, this elevated pressure can lead to the development of hypertension, loss of elasticity in the vascular walls, and ultimately, heart failure. In medical practice, there are cases where patients who adhere to a healthy lifestyle, avoid fried foods, exercise regularly, and even abstain from alcohol, wonder why their blood pressure remains high. The reason may be a few slices of pickles, subtly negating all their efforts. The most insidious aspect of salt's harmful effects is its asymptomatic course in the early stages. A person may not experience any noticeable signs of discomfort until a stroke occurs, chest pain arises, or a discouraging diagnosis of congestive heart failure is made. After the age of 60, the kidneys lose their former efficiency in filtering salt, and blood vessels become more fragile, making the body particularly susceptible to hidden dangers in the diet. Ordinary pickles, canned vegetables, and even seemingly healthy soups can be veritable salt bombs, subtly undermining efforts to maintain health. In this situation, cooking at home becomes not just preferable but essential. Carefully studying product labels and using herbs and lemon instead of salt when preparing dishes can be invaluable for the heart. However, salt is not the only hidden threat lurking in the kitchen. There is another product that seems completely harmless, but can ignite inflammatory processes and gradually raise blood pressure with each consumption. Furthermore, red chili peppers, this fiery ingredient, can also pose a danger to heart health. For many older adults, food is not just a source of nutrients, but also memories, cultural traditions, and even comfort. And nothing awakens these feelings like a pinch of spice, a pinch of red chili pepper. Spicy soup or a fiery roast is not just a dish. It's part of tradition, taste, and passion. But many do not realize that this small, fiery vegetable can cause serious health problems. Hot red chili peppers, especially their most pungent varieties, can trigger a cascade of physiological changes in the body. They have a stimulating effect on the nervous system, promote the release of adrenaline, and as a result, increase heart rate. For young people with robust health, this usually does not pose a serious threat. However, in old age after 60, when blood vessels lose their elasticity and the heart becomes more susceptible to external influences, such stimulation can be unsafe. In medical practice, there are frequent cases where older patients seek help with complaints of rapid heartbeat, constricting chest pain, or sudden fluctuations in blood pressure, which are often the result of eating spicy food. At the same time, the person may not even suspect a connection between their condition and the seasoning. The danger lies not only in the burning taste, but also in the stressful reaction that pepper provokes in the body. Blood vessels constrict, blood pressure rises sharply, and in the presence of cardiovascular disease or hypertension, even one spicy meal can lead to serious heart rhythm disturbances or trigger an attack. Moreover, regular consumption of hot peppers in the long term can cause chronic inflammation of the vascular walls, gradually destroying the circulatory system that ensures normal heart function. It is not necessary to completely abandon bright flavors. However, to add palatability to dishes, it is not necessary to use pungent spices. Aromatic herbs, garlic, ginger, and lemon can transform any dish without creating additional stress on the cardiovascular system. It is important to listen to the needs of your body. Products that evoke a strong desire may bring short-term satisfaction, but it should not be forgotten that such comfort should not cause overexertion of the heart. If even spicy food can subtly harm the heart muscle, what can be said about a product that is universally praised for its healing properties, but in its raw form can be dangerous? We are talking about raw garlic. This natural healer, which occupies an honorable place in folk medicine, can turn into an enemy of the heart if used incorrectly. For centuries, garlic has been valued for its ability to lower cholesterol, thin the blood, and support cardiovascular health. Many older people unconditionally trust this product, adding raw cloves to various dishes or even swallowing them whole, as if they were medicine. Indeed, garlic can be a powerful ally in the fight for health, but its strength, if used incorrectly, can turn into a treacherous poison. Most people do not realize that raw garlic is a potent natural anticoagulant. When combined with certain heart medications, especially anticoagulants such as warfarin or aspirin, it can dangerously amplify their effect. This leads to excessive blood thinning, increasing the risk of internal bleeding, bruising, and in some cases, life-threatening hemorrhages. Medical practice often encounters the consequences of seemingly harmless, healthy lifestyle habits. Doctors have to assist patients whose nosebleeds cannot be stopped, who have black stools, or a sudden drop in blood pressure. The cause, as it turns out, is a belief in the unconditional benefits of garlic. However, the problem is not limited to bleeding. Excessive consumption of raw garlic can cause a sharp drop in blood pressure. For people already taking medication for hypertension, this can lead to dizziness, general weakness, and even loss of consciousness. In conditions of insufficient blood supply to the heart, serious complications arise. The most unfortunate thing in such situations is that people sincerely believe that they are acting for their own good. They give up harmful products, take care of their health, and believe in the healing properties attributed to garlic for centuries. But even natural products have their limitations. With age, the body undergoes changes, and what previously benefited may unexpectedly cause harm. Optimal health decisions are based not only on tradition, but also on a deep understanding of the processes occurring in the body. If you like garlic, eat it in moderation and cook it. But before making it a daily habit, be sure to consult your doctor. However, if even ordinary raw garlic poses a potential threat, what can be said about products that seem even more harmless? About those that are fresh, pleasantly crunchy, and often eaten without heat treatment, but may contain a hidden enemy that the weakened body is no longer able to cope with? We are talking about raw sprouts. At first glance, this is a harmless, crunchy product, but for older people, it can cause serious health problems. Sprouts, such as alfalfa, beans, or mung beans, are often touted as a superfood thanks to their crunchy texture, high enzyme content, and live energy. Many older people striving for a healthy lifestyle consider adding a handful of sprouts to a salad or sandwich an excellent solution. However, behind their fresh and attractive appearance lies a danger that can seriously damage health. The fact is that sprouts are grown in a moist and warm environment, which is ideal for the reproduction of bacteria such as E. coli, Salmonella, and Listeria. While foodborne illnesses usually pass without serious consequences for young people, they can pose a serious threat to older people. With age, the immune system weakens, and the body loses its ability to quickly and effectively fight infections. As a result, a common upset stomach can quickly develop into sepsis, dehydration, or even endocarditis, a dangerous inflammation of the inner lining of the heart. Many years of experience working with elderly patients suffering from heart disease allows us to observe how seemingly harmless infected sprouts can lead to serious consequences, such as hospitalization, cardiac arrhythmia, and exacerbation of heart failure. At the moment when the body is actively fighting the infection, its ability to restore the heart muscle is significantly reduced, while such infections often go unnoticed until it is too late. The paradox of the situation is truly upsetting. Striving to eat fresh, green, and healthy foods, a person risks suffering from what should have brought him healing. That is why the consumption of raw sprouts should be treated with special caution. If the love for them is insurmountable, it is recommended to subject them to heat treatment. Quick frying or steaming effectively destroys harmful bacteria while preserving the taste and beneficial properties of the product. When it comes to protecting your heart, it's important to consider not only the composition of the food you eat, but also the methods of preparation and your body's ability to digest it at any given time, taking into account age-related changes. If even sprouts, known for their benefits, can pose a certain danger, what can we say about vegetables, which are considered safe in themselves, but can become harmful when interacting with cardiac medications? Perhaps such a combination is already present in the diet of some patients. In this regard, an important question arises. What foods should be included in the diet of older people to effectively protect their heart? Following the realization of the potential danger of some vegetables for the cardiovascular system, the question naturally arises. What foods should we eat then? What elements of the diet can support heart health, strengthen it, and maintain strength in adulthood? after 60 years? The answer to this question lies not in fashionable diets or exotic superfoods, but in turning to simple and affordable vegetables that best meet the needs of an aging heart. We are talking about products that can reduce inflammatory processes, stabilize blood pressure, strengthen blood vessels, and harmoniously interact with medications taken without conflicting with them. Excellent examples include boiled broccoli, tender baked carrots, braised kale, sweet potatoes, cooked tomatoes, and heart-healthy legumes such as lentils and green beans. These foods are rich in antioxidants, potassium, fiber, and plant compounds that actively protect arteries and reduce the load on the heart muscle. Unlike raw sprouts or pickles, these vegetables have a mild effect on the body, are easily absorbed, and help maintain stable blood sugar and blood pressure levels. In adulthood after 60 years, the heart does not need extreme diets. It needs consistency, balance, and products that truly care for its health. Observations show that patients restore the health of the cardiovascular system not only through drug treatment, but also through enriching the diet with simple, warming, and healing dishes. We are talking about such elementary, at first glance, things as a portion of lightly processed greens, baked root vegetables, or a bowl of nutritious bean soup. These modest but regular gastronomic decisions can neutralize the consequences of many years of imperceptible destruction of the body. There is a common misconception that healthy food must be bland and tasteless. However, this is far from the truth. Aromatic herbs such as rosemary, turmeric, garlic used in reasonable quantities, as well as fresh lemon, can give dishes exquisite taste without creating additional stress on the cardiovascular system. It is important to remember that food should be a source of not only physical, but also mental saturation. Now that the question of proper nutrition has been clarified, it is worth paying attention to another important aspect. Even the most useful vegetables will be powerless if the heart continues to suffer from one seemingly insignificant but extremely harmful habit. We are talking about a heart that can still be saved. This tireless organ beats for a person from the moment of his birth, making more than 2 billion beats by the age of 60. For a long time, the heart did not require anything in return, but now it is calling for attention. Aging is not a reason for resignation, but an opportunity to become wiser. Wisdom lies in realizing that previous ways of maintaining health may no longer be beneficial. Vegetables that were useful in youth can, over time, imperceptibly cause harm if consumed incorrectly, at the wrong time, or in combination with unsuitable medications. However, there is also encouraging information. Not all is lost. The damage done is not irreversible. Every small step taken today, whether it is choosing food, giving up bad habits, physical activity, or complete rest, can start the recovery process, neutralizing the consequences of many years of hidden stress. The author has witnessed such transformations when elderly people who seemed exhausted and weakened regained energy, clarity of mind, and ease of movement. And this happened not thanks to extreme measures, but thanks to careful attention to the needs of their body and consistent adoption of the right decisions. Striving for perfection is not required. Only consistency is important. The human heart still has enough potential, strength, and love to support both the person himself and his loved ones, as well as the life that he has so diligently created. We need to start acting today, reassess our diet, change our habits, and restore our energy. After all, every subsequent heartbeat is a priceless gift that one must cherish. This knowledge is intended to inspire people to live a full and rich life. It is worth taking the time to reflect and share one discovery that you have made for yourself and are ready to put into practice. It is important to support each other on this path, embracing these truths.